Standing by is somebody who knows. Paul Seegert is a managing partner at PCS Advisors. He's been on my show a lot because he understands the role that healthcare plays with regard to individual, with regards to employer, insurance companies, and these gigantic healthcare groups that are just getting bigger and bigger and bigger. In fact, he's got partners in 35 now states. And so it's with great interest on this, we welcome in Paul Seegert. Paul, how are you on this glorious Tuesday?
I'm doing great.
Glad you're here. So this seems like a real concern if hospitals like Memorial Sloan Kettering Cancer Center in New York, one of the top cancer centers in the country, is laying off over 300 employees, and it's losing, it looks like, $3 million more in a quarter, year to year. There's a real issue going on because one of the top, I would guess, I hate to use money, but one of the top money generators for the healthcare industry is cancer care. So what's going on here?
Well, what we have is a situation where hospitals are losing money. And we've talked before, and it's an ongoing, long-running trend for rural hospitals and urban hospitals in poorer areas to struggle. But we have broad struggle going on across the whole hospital industry. More than half of hospitals posted a loss for 2022. And there's a handful of factors that are driving that. The broader inflation in the economy is certainly impacting hospitals. Cost of labor has gone up tremendously. They were already facing a shortage. That shortage got worse during COVID. Mm-hmm. And then you have the fact that they negotiate multi-year contracts for reimbursements from health plans. And a lot of those were set prior to all of this happening. So they were getting reimbursements that might have been sensible and profitable before COVID, before inflation, before increased cost of labor, but they were underwater after that. And so those will be coming up for renegotiation. And I expect we'll see some increases, of course, in those reimbursements to account for a lot of what we're seeing.
Nobody is going to cry for a major corporation, and that's what healthcare is anymore. These are major corporations, even at the local level here in Cincinnati. Nobody's going to cry if a hospital is losing money until you go to that hospital and you don't get the care that you need or would have gotten in a different time. So to you, to me, to anybody else that are users, that are consumers of what hospitals offer, what does that mean to us? You mentioned higher premiums, higher costs, but what else?
Well, it's going to impact the quality of care. We already faced a shortage of nurses, as an example, and we're running up against we'll need 500,000 more nurses in this country, and and you have issues. It creates a couple of issues. Quality of care, of course. We already had staffing shortages, and you could have whole departments that did not have enough staff to be doing what they were doing. That got worse during COVID to such a degree that some hospitals would discontinue offering certain services because they simply couldn't staff for it. Mm-hmm. And then you have hospitals, we've got over 600 that are at risk of closure, with 200 of those at immediate risk. And a lot of those are rural facilities, but they're urban as well. You'll have hospitals right in the downtown areas of very large cities in this country that are at risk. And that gets to access, and now you're impacting people's ability to access care, which affects mortality and all kinds of things.
So, it would seem like, though, the demand for hospital care has not dropped. It might have waned during COVID when certain selective surgeries were not available, or it might have waned during COVID when people were just shut in and not trying to go anywhere. But it doesn't seem like the demand for the services that hospitals offer has waned all that much, has it?
Well, you've got a long-term trend of a reduction in hospitalization for certain things. We've gotten better at treating certain things or performing certain procedures. It used to be you'd get a joint replacement or something like that, and you'd be in the hospital for a week. Fast forward to today, some of these things are just same-day procedures now. So there has been a reduction in hospital. We need hospitals less for some of those things, but we're not going to get away from needing high-level emergency services for things like heart attacks. And some of that stuff is not on the decline by any means. It's on the increase. And so having at least really good emergency care, I think that's one of the risks we face as we watch facilities close.
Is this going to get better or worse as you see it here in calendar year 2023? In other words, are we going to see the stress continue? Are we going to see layoffs continue? Where do you see this going?
I think it will get worse before it gets better. You've got the fact that government programs, Medicare, Medicaid, Medicare has reduced what it reimburses these facilities, and they already lose money on Medicare reimbursement. And you have a bunch of people on Medicaid. As soon as this public health emergency is finally kind of wrapped up, a lot of those will lose that Medicaid coverage. We've got, depending on who you believe, we've got as many as 15 million people on Medicaid that actually don't qualify for it.
Wow.
But part of the COVID rescue stuff that we did gave additional funding to states with the condition that they did not audit the enrollments. So there's a ton of people that will get booted off those programs, and some of them will join the uninsured, and that'll put a bigger strain on some of these facilities. It's better to lose a little money on a transaction than get no money.
Yeah.
Paul there's issues all over the place.
Yeah. Paul Seegert's our guest, managing partners, PCS Advisors. The Congress has got to deal with something between now and October, because if they're not, this, as you just alluded to, hospitals face even more cuts. I think $8 billion cut to their Medicaid payments each year. So what is this that Congress needs to do with? In other words, how does what is in front of them with this Medicaid issue that has to be passed, or these cuts go into effect in 2024, how does that affect the general public, you, me, and everybody else? Does it mean that these costs and these services rise even more? And why wouldn't Congress act on this anyway? I mean, my goodness, what's more basic than health care?
Well, absolutely. I think, yes, it impacts the whole system, because if you increase the number of uninsured and or you continue to, and you, as a government payer, which is now the largest payer in this country, 51% of people get their coverage from the government as of this moment, which is, to me, a major conversation that we should all be having. Is that a good thing or not? It's not a good thing if you just put politics aside. It's not a good thing if 51% of people that show up at the facility, the reimbursement that's paid or the payment that's made to that facility doesn't cover the cost of their care. Sure. So you have a majority of people whose care is not being paid in full. So a minority of people have to get charged more.
Right.
So it's going to worsen this trend of employer plans and commercial payers seeing bigger increases to make up the gap.
And it's, from a societal standpoint, we're not producing more workers. People are having fewer and fewer children. So the workforce is not going to get stronger, larger in the ensuing years, which means that the taxes that are extracted from that decreasing workforce aren't going to be able to cover the 51% that could go to 60% here very soon. So there's another problem on top of this.
Yeah, and I know this will absolutely be a moment, I think, as a country where we start to talk more about single-payer healthcare. And I would encourage people to look across the pond and see what's going on with the National Health Service in the UK and what's going on in Canada and other countries that have gone down that road. And it's absolutely, by the math, it's absolutely imploding. The average wait time, if you're having a heart attack or stroke, is 90 minutes right now in the UK. You have people 5 minutes from a hospital dying in their 50s from something that here would be easily treated. So I don't think that's a solution. I'm not saying that we're doing a perfect job. We're not. We have the best healthcare in the world. We're not that good at paying for it yet. But I think we can. This is the United States of America. We innovate. We solve problems. We can do a good job of this. But it's going to take, obviously, some massive change. Transparency is, in one word, that's being blocked by 14 or 15 lobbyists per every member of Congress to not change the way we pay for healthcare. It's incredible.
Yeah, we have to change the way
we can do it.
We can do it, but we have to change the way we go about our business of doing it, and those that go about the business of funding it, aka Congress and those that are above Congress in the current administration and others. They got to go about a different way of getting this thing done, because it's not working. And if you go to single payer and you use the UK or Canada for that matter as an example, I think the health care in this country goes down dramatically, and I don't think, and I'm not the only one screaming that tune. Paul Seegert, great to have you on the show. It always is. Stay well, my friend. We'll talk down the road.